Registered nursing homes in New York State, these facilities have to take on a lot of responsibilities. Today I visited the Hampton Center for Rehabilitation to see what a normal workday is like for these nurses. I sat down with the Assistant Director of Nurses to see what these nurses do on a daily basis.
I'm responsible for overseeing the care that's provided to the residents, making sure that the staff does what they're supposed to do, and that the residents are comfortable and well cared for.
These nurses work non-stop and work an array of hours. With working all these hours come a lot of sacrifice. And when I sat down with Mary Ellen, a nurse practitioner at the Hampton Center, she tells me exactly what she's missing.
A normal nurse usually works a 40-hour week with some overtime. When you get into these higher level nursing jobs, it's a salaried job. So I typically work anywhere between 50 and 60 hours a week. My children are grown, which is a great plus for that, and I have a very understanding husband, but I'll spend an awful lot of time with the residents during the day and then try to catch up with charting, which is required by federal law, at night. Throughout my 30-year nursing career, I've missed school concerts, family gatherings. Nursing is a job where the patients come first.
There are numerous things these nurses always have to keep in mind between patients going into cardiac arrest or a resident falling and hurting themselves. The nurses always have to be on their toes. At the Hampton Center, there are 7 different units with a total of 280 residents, with nurses on each unit responsible for 40 residents. While there are many residents, there are also many different personalities, and these nurses have to adapt to each person to make each resident feel like they are in a safe place.
Each person is individual. Each disease process that they have is individual. So you have to think about the disease, you have to think about the residents' needs and what they need right for that moment. And you have to adapt in order to be able to properly treat them and get to their heart, to get past everything else that you see. You have to get inside of them and inside their mind and heart to be able to care for them better. And that's how I do it.
There are units where we have fully alert and oriented people who are aging, who have fallen on the ice, broken hip, and they need to be here for physical therapy, occupational therapy. They're just as clear as you and I are, and you speak to them just like a patient in an outpatient setting. However, you move along and there's people in various stages of dementia, and you have to vary the way that you care for them based on the amount of cognition that they have. You have to be very soft and slow with them. You change the modulation of your voice from a high pitch to a low pitch so they can hear you. There's an awful lot that goes in.
A lot of the time in long-term care, it's giving enough fluids, looking after skin care and pressure care for those people who don't move so well, and keeping them as healthy as possible and preventing things from happening. And falls in long-term care too are very, very common. We're trying to reduce the number of falls and the injuries from falls. So yeah, it's all education. So those things are always on my mind. And then I start to give out the medications, I do the treatments and the dressings. The needs of a person in long-term care are very, very different from the needs of the average younger person. And most of the time these people are somewhat healthy when they go in there, but assessment, caring, and compassion.
Each of these nurses work very close to the residents and grow an attachment to them. And unfortunately, many residents pass away, which makes their job that much harder.
What hurts me the most? Watching somebody suffer. It's very, very hard for someone that you care, when you get an attachment, and that's what long-term care is, that they become part of your family. When you see someone that you care about hurting, or if you see someone not caring for them the way that you'd want them to be cared for, it's very hurtful.
Quality of care is all the time, yeah. Some days you can't give what you want to because of your workload, because there's so many other external things. But the essence of it should be there all the time. I mean, walking into the room, the way they've got their room set out, something's not right, you put it right for them. It's just the little, tiny little things that do mean a lot. So it's all the time.
You would think with all the time and work that goes into making sure these residents are happy and healthy, that all the families would appreciate everything they do. Unfortunately, that isn't always the case.
With experience comes the realization that you can't please everybody all the time. You try your best to try to communicate to people so that their needs are being pretty much met. Sometimes you'll see families with demented patients and they're not really accepting of the disease process. So they're striking out at anything they can reach out for, and a lot of times they'll strike out at the person they're most comfortable with. And hopefully you've made yourself the person that they're most comfortable with, and they'll tend to be aggravated with you, kind of like how a teenager would be acting out on their parent because they're the most comfortable with their parent.
While there are many registered nurses in New York State, there are only a select few that become long-term care nurses. And when I asked each nurse why they decided to go into that field, and despite the long hours and the amount of work they have to do, they all have relatively the same answer as to why they keep doing this job.
It's where I felt most comfortable, taking care of people who are towards the end of their lives, to have an opportunity to respect them and care for them towards the end of their life is something that I have a passion for.
It's not the big things that you accomplish, it's kind of the little things. I remember meeting with a young lady on the surgical unit, and she was only about 16, and she had to have her tonsils out. And I admitted her, and I started talking to her a little bit about the pre-op and the expectations, and she was very thankful that I went over that with her, because she told me that her parents were so frightened that they didn't want to discuss anything. They didn't want to talk about it, they didn't want to explain anything to her, and that made her much more uncomfortable. So things like that, when the person turns around and says thank you. And then what happened is about a month later, she showed up. She showed up on the unit in the hospital, walked up and gave me a rose. I didn't even remember her. I actually did a double take because I had admitted so many people and taken care of so many people. But I made an impression on her because I made her stay there and her surgery so much easier.
I love this job. A lot of people have said you're very smart. Why didn't you go to school to be a doctor? I hear that all the time. I say, no, nursing is a specific science. It's very different. It's a science and an art. Medicine is kind of a science and an art, but they lean more on the science side. We are more about the person, we see the whole person in the bed. We see that they're feeling anxious today. Well, why are they feeling anxious? Maybe it's because of a medical problem, but it could be because they just missed their daughter who just left 15 minutes ago. I think that gives us a unique advantage and viewpoint with the patients.
There are so many rewards. They're not financial, they are more a feeling of accomplishment, seeing lots of human nature, knowing what you're capable of in the worst situations. I feel very compassionate and very passionate about looking after people who are in a very vulnerable situation in their lives. They've lost a lot. You help them transition from being out in the community or in another facility at a time when they are losing lots of things. So you see that, and you see that in their families as well. So if you can help them transition into this place where they will have a lot less, but you can still give them a lot. And what they really need is love, and sometimes a hug, a nice little conversation. And as you work with them, the longer you work with them and the more you get to know about them, you can bring that back into the conversation. It's just like another family member almost, you know. And it's very difficult sometimes with the volume of people we look after to get to know anyone really well. And then one day you're surprised you didn't know that lady could play the piano like that.
Because despite all of those negative things, when you make a difference in someone's life, be it at any time when they're ill or at the end of their life, and somebody who's been hurting, you finally see them comfortable, or somebody who's sick and you finally see them getting better, there's a reward in that you can't explain. And that's what makes me come back every day.